Hello, my name is Brittany McAndrew. I'm a speech-language pathologist at Cressman Neurological Rehab, part of the Norton Neuroscience Institute. Today I want to talk with you about speech and swallowing changes that can occur with Parkinson's disease and how we can improve and preserve these abilities. Parkinson's disease is a movement disorder that can affect the motor movements used for both speech and swallowing. In fact, about 90% of people with Parkinson's disease experience changes in their speech, and 50 to 80% experience changes in swallowing. Speech-language pathologists are an important part of the Parkinson's multidisciplinary team, helping to evaluate, treat, and maintain these abilities throughout a person's journey with Parkinson's. Let's first talk about how Parkinson's disease impacts speech and swallowing. In the brain, we have a chemical called dopamine that allows many of our body's movements to happen automatically. With Parkinson's disease, there's a loss of dopamine, which makes these automatic movements more difficult. Because speech and swallowing are highly automatic processes, they can become smaller and less coordinated when dopamine levels are low. For speech, this means the voice may become softer or more hoarse. Mouth movements can become smaller and less precise, making speech sound mumbled, rushed, or quiet. For swallowing, smaller movements can make it harder to chew food well and to use enough muscle strength to move food or liquids safely down. This can feel like food or pills getting stuck, increased effort to swallow, or coughing during meals or drinks. Another part of the brain affected by Parkinson's is the basal ganglia. This area helps us process sensory information. In other words, it helps us understand how our body is moving and functioning. Because of this, people with Parkinson's often don't realize that their speech is softer or their movements are smaller than normal. They may feel their voice sounds normal even when others are having a hard time hearing them. This happens because the brain's sensory feedback system is not accurately detecting those changes. The key to treating and preserving speech and swallowing is to activate the intentional motor system of the brain, called the pyramidal system. When we speak and swallow with purpose and intent rather than automatically, we can bypass the part of the brain that relies on dopamine. What this looks like is speaking with purpose every time you talk, and chewing and swallowing with focus every time you eat or drink. It should feel like a conscious effort, a focus on what your body is doing as you speak and swallow. There's a Parkinson's program designed to train this called Speak Out Therapy. This program can be started with a physician's order to a rehab clinic that treats Parkinson's disease. It's a 1-month intensive program that includes daily home exercises and in-person sessions twice a week with your speech therapist. At the start of the program, we complete evaluations for speech and swallowing, introduce treatment, and provide a customized home exercise plan. After completing the program, patients transition to a maintenance phase with follow-up visits about every 6 months to make sure skills are maintained. If additional support is needed, treatment may include communication strategies or environmental modifications, use of gestures or supportive communication systems, swallowing strategies or diet adjustments, and family and caregiver training for extra support. Over time, if these symptoms are not addressed, the muscles involved in speech and swallowing can weaken. That's why early intervention with a speech-language pathologist leads to the best outcomes. But treatment is beneficial at any stage of the disease. With consistent practice and focus, speech and swallowing can be improved and preserved over time. For more information about building your Parkinson's care team, including speech, physical, or occupational therapy, please speak with your provider to obtain an order for services. Thank you for your time. Again, I'm Brittany McAndrew, speech-language pathologist with Cressman Neurological Rehab and the Norton Neuroscience Institute. Thank you for being with us today.